Welcome back, everyone. Today we're going to talk about how to recover fast from illness naturally using glutathione like Glutaryl, hydrogen therapy such as the machine from Holy Hydrogen, and red light therapy like the machine from EMR Tek. These tools have helped me and my family reduce symptoms and recover in just 1 to 3 days. At times, they have completely stopped the progression of an illness. Today I'm going to walk you through each of these tools, what it does, why it works, and exactly how I use it step by step. After experimenting for several years using these tools and others, I have found that in combination, this has been the best protocol to help reduce and improve illness, especially things that tend to be acute. First, let's talk about glutathione with the brand Glutaryl. Now, I do have a video on this specifically, so if you'd like to check that out, I'll put the link here and in the description below. Glutathione is your body's master antioxidant. It helps detox and support the liver and reduce oxidative stress. When I am sick, the way I like to use Glutaryl, and this is the Glutaryl Plus brand, this is the formulation I use when I'm sick and I'm trying to recover quickly. My protocol is 4 sprays every 4 hours. For example, I will start 4 sprays at 8 a.m., 4 sprays at 12 p.m., again at 4 p.m., and then finally at 8 p.m. right before bed. Once I start to notice a significant improvement in symptoms, I start to reduce the dose. So start to titrate down. So it'll look something like 4 sprays 2 times a day or 4 sprays 3 times a day, depending on how much improvement I have seen, until finally I can go down to 4 sprays once a day and then eventually not take it at all. Or if you're still having a significant amount of lingering symptoms, maybe it's like a lingering fatigue or a lingering malaise, then I will still spray a small amount of the glutathione, maybe 1 spray once or twice a day, just enough to see improvement in those symptoms. And I just keep titrating down until I feel like I have completely recovered. The key to using this is to really listen and assess your body to see how you're responding. So you want to see a progressive decrease in symptoms. You don't want to overdo and you don't want to spray excessively. You just want to spray enough to see a reduction in the symptoms and keep titrating down. At least that's how I approach it. And again, you can refer to my video on Glutaryl for more information on the product and the company's recommendation on dosage. Okay, so now let's talk about hydrogen therapy. I love hydrogen therapy. I think it's one of the most impactful biohacking tools out there. I think it has a great range of benefits that it can really give somebody that's looking to improve their health, or for somebody who is trying to biohack or just approach wellness from a longevity standpoint, trying to prevent progressive decline as we age. For hydrogen therapy using the Holy Hydrogen, and I have a video on that if you want to check that out, where I discuss and go into more detail about how to use this machine and also just some basic information about hydrogen therapy. When I first noticed that I am starting to get sick, be it like a viral infection of some kind, this is the protocol I follow. I will do 2 to 3 sessions a day of hydrogen therapy inhalation, and that'll be at about 1.5 hours per session. So 1.5 hours a session, 2 to 3 times a day, if I notice that I'm coming down with an illness such as what I perceive to be like a cold or a flu. For example, I will do a session at 8 a.m., one at 12 p.m., and then finally one at 4 p.m. Very similar to when you're using glutathione, you want to see a reduction in symptoms. If your symptoms are going down and you're feeling better, then you know you're on the right track. After I start seeing improvement, I then begin to reduce the amount of inhalation that I am doing. So I might reduce it to 1 to 2 times a day. I like to keep my sessions at 1.5 hours. Similarly, as to when you're using glutathione, you want to see that your symptoms are coming down, that your symptoms are reducing. You want to check in with your body. Is your head hurting? Are your muscles aching? Are you getting cold chills? Is your nose still running? Are you still coughing? Whatever it is that your symptoms are, you want to see that they've progressively lessened and that you are generally feeling better, that there is a reduction in a general sense of malaise and in a general sense of lessened fatigue, and that your energy is starting to return to normal. So you want to assess in all of those areas and see that those symptoms have gone down. And so you can also bring down the amount of therapeutic interventions that you are doing. I also wanted to talk about drinking the hydrogen water when you're feeling sick. From my perspective, obviously the hydrogen inhalation is super beneficial. If you want to even push it further, drinking the water from the holy hydrogen is definitely going to just increase the benefit and also increase the potential that your body will have the resources it needs to fight off the illness that you're dealing with. I find that beneficial. I will try to drink at least a liter of the hydrogen water. I know when my spouse was sick, I would encourage him to drink 1 to 2 liters of the hydrogen water, and I found that to be really beneficial to him. Obviously, you know, you're not feeling well and you're not really motivated to do a lot of this, but I do find that it makes a huge difference. If you drink water, number one, you're preventing yourself from getting dehydrated, but two, you're really absorbing and you're saturating your gut with all of this good hydrogen water, all this good antioxidant, and it's helping reduce all of that inflammation that you're experiencing, especially the gut with all those bacteria that impact our immune system so much. I think that it is a big key to drink the hydrogen water and to do the inhalation in conjunction with each other when you are not feeling well due to illness. Drinking at least a liter of the hydrogen water for an adult such as myself, around 130, 150 pounds, 1 liter of the hydrogen water is ideal for me, but you'll have to see how you respond. Obviously, do not drink excessive amounts of water, as that can have its own problems, so be careful there. Drink to your own intuition and carefully assessing how you are responding and that your symptoms are reducing. Okay, so now let's talk about red light therapy. I like to use the EMR Tek for my everyday use of red light therapy. I do have a video where I talk about the EMR Tek, some of the benefits and how I use it. If you want to check out that video, I will link it below and I will put a little tag so that you can see that video. Red light therapy boosts cellular energy production, which is really, really important, especially when we're sick and we're feeling fatigued and we're feeling malaised. We need as much energy as we possibly can get so that our immune systems can fight off any bacteria or viruses that are impacting us and making us sick. So that's one important benefit of using the red light therapy, is that it can give you a little bit of energy and just reduce that malaise and fatigue when you're sick, especially if you're having shivers or if you're having a lot of muscle aches and pains. I find that red light therapy really helps to alleviate a lot of those symptoms, or at minimum reduce the severity. So red light therapy also stimulates the mitochondria. If you don't have a red light therapy panel at home, I would say you could go outside for about 15 minutes, try to get exposure on your skin, right? So don't wear long sleeves, wear something where the sun can actually hit your skin to get the best benefit. Obviously, be mindful that you are not overexposing yourself and that you're getting burned. But I find that even a little bit of sunshine, a little bit of sun hitting your skin does also help with muscle pain and tightness. The red light therapy protocol that I follow when I'm getting sick is 1 to 2 20-minute sessions a day. So it could look something like first thing in the morning at 8 a.m. and again right around 4 p.m. or even a little bit later, as long as you know how red light therapy impacts you. So if it tends to wake you up, I would definitely shoot for earlier in the day, like in the evening, or maybe around 6 to 4 p.m. And I would not do it any later than that. If you have found that you've done red light therapy and it doesn't impact your sleep, then yes, you could do it, between 4 and like 7 p.m. and probably be okay. But you do need to pay attention and know how you react to red light therapy so that it doesn't impact your sleep, since sleep is so important when we are trying to recover from illness. So once I'm starting to see a reduction in symptoms, I typically go down to 1 20-minute session a day. I tend to do that even when I'm not sick. For me, I do well with 2 sessions back to back, so sometimes I will do up to 40 minutes. I tend to do very well, and that feels right for me and right for my body. As always, make sure that you are responding positively to the red light therapy. Over the last several times when I've started to feel sick, or my spouse has been starting to feel sick, I tend to do this protocol for at least 1 to 3 days, and then as we are tapering off, maybe another 1 to 2 days. So total, maybe around 5 days of time that I put in the effort to work these protocols into my day to make sure that our illness does not progress, or that at minimum we are recovering faster and reducing our symptoms. The protocol that I use is glutathione spray from Glutaryl, 4 sprays, 4 times a day, and then tapering down as my symptoms are reducing. Hydrogen therapy, inhalation in particular, 2 to 3 1.5-hour sessions a day and tapering off as I am recovering. Red light therapy, 1 to 2 20-minute sessions a day and tapering down to 1 session when my symptoms have reduced. I find that if I start these therapies early when I first notice those initial symptoms, I tend to see a complete reduction of any signs of getting ill within 1 to 3 days. But if I don't catch them early enough and I'm already, maybe about 2 or 3 days into moderate symptoms, the best I can tend to hope for at times is at minimum a reduction in those symptoms. So the key is catch it early, catch it fast, don't delay, don't procrastinate, get going and start incorporating these therapies into your routine so that you don't have to suffer and be sick for several days. Remember, the longer you wait, the longer the bacteria or virus has time to replicate and make you sick, making it harder to manage, especially in those 1 to 3 days when you're first noticing symptoms. If you have found this information useful, please take the time to subscribe and support my channel in that way. I would greatly appreciate it. I do have individual videos already on my channel about hydrogen therapy, glutathione from Glutaryl, and red light therapy from EMR Tek. Take the time to check them out. You might learn something new. This video is only intended for entertainment and educational purposes only. I am not a medical professional, and this is not intended to be medical advice. Always consult your doctor before making any changes to your health routine. Thank you for watching.